everyone. I'm Dr. Indu Taneja, working as Director in Cloudnine Hospital, Faridabad. So I'll be talking about the diet and the physical activity in pregnancy. Most of the time question asked in the first trimester is, Doctor, what should we eat? In the first trimester, generally I tell whatever you feel like eating, you should eat. Because first trimester, most of the patients, they have nausea, vomiting, they don't feel like eating. So nothing is imposed regarding the diet. So they should eat whatever they feel like eating. But they should not keep themselves empty stomach for a longer time in case they feel that they have vomitings. They should keep on eating something or the other after every 2 hours. Everything cooked at home, all fruits brought at home, washed, peeled properly, can be eaten. Some people, they do ask, should we eat papaya? Is it not going to harm us? So it's a myth. You can eat papaya also. Papaya seeds used to be considered abortifacient, but not papaya. So you can eat a bowl of papaya every day. In pregnancy, mostly patients have constipation. So papaya is really good. It relieves constipation. So you can have everything. Only thing which is avoided in first trimester is don't eat junk. Don't eat from outside, especially the uncooked raw food. Don't drink alcohol. Quit smoking. These are the things which are generally avoided. Then what kind of physical activity in the first trimester one should have? One should continue to have all type of activities which one was doing before pregnancy. So they can continue walking. If they are doing some kind of light exercise, one can continue doing light exercise also. Only thing which is to be avoided during first trimester of pregnancy is the strenuous exercises, jumping, and going to the gym, doing heavy exercise. This should be avoided. Traveling, one can also continue doing traveling. If one is doing swimming, you can continue doing swimming also. In the second trimester, definitely the diet has more important role because the nausea settles down. One feels hungry. So diet which is recommended in pregnancy is high protein diet and low fat diet. High proteins means if you are vegetarian, definitely the protein comes from the milk and the milk product, dairy products mainly, soya products, pulses. If you are non-vegetarian, you can have eggs, meat, chicken, fish, all foods you can have. If you are not allergic to fish, you can continue to have fish also. Only one should avoid the red meat. And what kind of physical activity one should do during the second trimester is, you can continue doing all activities. What extra is, you start doing some kind of exercises, you should do walks, you start doing some breathing exercises, then the yoga should be done, and some kind of light weightlifting exercises one can do during the second trimester of pregnancy. Then in the third trimester of pregnancy, you should continue eating high protein diet. If your blood pressure and sugars are normal, you continue eating all whatever you were eating in the second trimester. Only thing, if your sugars are high, you should cut down on the sugars and the diet low in carbs should be taken. And if your blood pressure is high, then definitely fats and salts, extra salts are to be avoided. Otherwise, you keep on taking the high protein diet. And sometimes in the last trimester, the patients, they do ask, should we take ghee in the milk? Actually, ghee in the milk is not going to do any good to you. It's not going to make your delivery easy. It's rather because you people are not used to having ghee, it can cause nausea and vomiting, and you may not eat the normal diet. So ghee and milk to be avoided during the last trimester of the pregnancy. And physical activity, definitely one should increase walking and breathing exercises and start doing squats also, which will help in having the normal delivery. So these are the things which you should do during your pregnancy. In case you have any other queries, I am always available. You can always come back to me. Thank you.